Okay. Hello, welcome. Thank you, Katie. And we've been discussing kind of role play scenarios here. Katie is an experienced clinician with a lot of experience under belt and certifications in different things like EMDR, licensed clinical addiction specialist. We want to do this video on how would you talk to clients about medications, and particularly important in an integrated care setting where they're interacting with medical professionals and mental health professionals and so forth. So I'm going to go ahead and role play as the client. Katie's the counselor, and so Katie, if I come to you and I'm like, "Hey, I know I know that Xanax has helped me with anxiety, and I don't know why the doctor is not giving me that," and you give me a bunch of stuff that doesn't seem to help. And so why can't that happen? I mean, I show up to my appointments.
Yeah, yeah, yeah. So yeah, you sound a little frustrated. You've got an idea about something that's been helpful for you before. You've been showing up, trying to work on your wellness. And the doc's like, Russ, I'm not giving you that. Yeah.
Yeah. Yeah.
Yeah.
Never had a problem with, I mean, maybe a little bit with alcohol back in the days, but I mean, I don't drink that much anymore. And so this helps. I don't know why they're not giving that to me.
Yeah. Yeah. This is something that you found helpful and you're like, come on, man. Like just give it to me. It's helpful. You're not currently having much alcohol trouble. Yeah.
Right.
Yeah. Did you and the doc get a chance to talk about it all? Why it might not be helpful?
Just says absolutely not. I don't prescribe that here.
Okay. So he was real clear, not going to happen.
Yeah.
Yeah. Yeah. Okay. It's good to, it's just helpful for me to know kind of what he shared.
Yeah.
Yeah. It makes sense to me that some folks like it doesn't feel good to have someone say, I'm not going to give this to you, or this is, they're worried about addiction. And I get it that you're like, I'm not having that problem right now. Right.
Right.
We do know that for some people, if they take a medication, a benzodiazepine like Xanax, and they've had some alcohol history before, it can actually kind of hit the same part of the brain that alcohol would. And so it can cause some people to then relapse on alcohol. So it might not necessarily be that he thinks you're drinking now, but it really can cause people to end up wanting to drink a little more. And so I know that that's one reason sometimes docs are just not comfortable. They don't want to put you in that spot, if that makes sense.
Yeah, I hear that, but it just seems like the medical profession hasn't done very much with panic disorder and anxiety. They just
Yeah.
want you to get hooked on other big pharma things. And for instance, let me share this, as you probably
Yeah.
know, I am on Suboxone, and
Hmm.
that works for me. That keeps me off of the opioids, and probably other stuff. Not that I've had big issues,
Yeah.
but I think it's also cut down on my need for alcohol.
Yeah.
But I've got surgery coming up, and my family doesn't know I'm on Suboxone.
Mhm. Yeah. Yeah. Well, one, I'm just want to tell you, I'm so glad that you're on Suboxone. We know that it really helps people feel better. You're right. That's one we know about. We know it really helps. And I really wish there was like a medication that worked just as well for panic, like that, the way that Suboxone can work for opioid use and addiction. We haven't found that medication yet. I sure hope we do. But right now, the way we have that one for opioid use isn't quite the same as just having one that really works for panic in that way. But I get it. You're like, this one works. Like, how come we don't have something that's really going to help with this other piece? And they may have shared this with you. I'm not sure. You tell me. But the other thing we know is that for folks that are on Suboxone, any kind of like that and a benzo like Xanax can really be dangerous because they both kind of settle things down, settle our nervous systems down, breathing. And with anything around opiates or treatment for opiates, we just never want people to be in the spot where if they were to take benzos and opiates, they could go to sleep and just not wake up, right? Not intentionally, not using, not even thinking about a relapse, just like these two things shut down our breathing. So it really can be dangerous. So that might be one reason too that they were like, man, I just don't want to put Russ in that spot.
Okay, I guess that's helpful. It doesn't make the anxiety any better, but I guess that's helpful to
Mhm.
hear.
Yeah, it sure doesn't. And I really hear that anxiety is something we want to talk about at some point. But I also heard you say you've got a surgery coming up. Would it be more helpful for you? You tell me. Do you want to kind of talk about this surgery coming up or this anxiety? I'm sure they're a little related, but what would feel the best way to use our time today?
Yeah, we're going to use surgery to cut out my amygdala so we know there's no more anxiety.
I wish they had that. Yeah.
Okay, we'll stop again. This is a role play. This is just how a behavioral health professional might talk with a client about their concerns about medicine. Clearly, the behavioral health professional will be in close consultation with the medical professionals. But clients are going to regularly ask about medicine. So behavioral health folks need to understand how to respond. And Katie just demonstrated that. So thank you.